continue getting vaccinated, to continue to test and follow all of those CDC and safety guidelines. The more individuals who receive a COVID-19 vaccine, the better protected our community will be against the variant cases of the virus. We ask that you remember the Pfizer and Johnson & Johnson COVID-19 vaccines are available, free and convenient at Barnett Park's drive-through site. Of course, we closed the site on Sunday and Monday of this week. However, Barnett Park is back open 7 days a week for the availability of testing and vaccinations. Currently, the Florida Department of Health in Orange County is reporting that approximately 59.18% of county residents 12 and older have at least one dose of the vaccine. As for the latest COVID-19 case numbers, Orange County's 14-day rolling positivity rate is 5.99%, nearly 6%, which is an increase of 1.89 points from our last news briefing. What that means is the numbers are not trending in the right direction. We will continue to monitor this number in consultation with the Department of Health and other healthcare experts to determine if adjustments become necessary in our community. Again, we must continue to increase the number of persons getting vaccinated in our community in order to reduce the positivity rate. Although that number may not be alarming to some, it is an important reminder that if we do not continue practicing common sense precautions, our numbers will start trending in the wrong direction. Since the start of the pandemic, there have now been 145,674 positive cases reported in Orange County and 1,362 deaths related to the coronavirus in Orange County. So now to provide more details within our community regarding the outlook of the novel coronavirus, COVID-19, Dr. Raul Pino, the Director of the Department of Health in Orange County, will share additional information. After he speaks, we are joined today. We have Division Chief Lauralee Avery of our Emergency Operations Center present, Ms. Sherry Babinski from the Orange County Public Schools, and Ms. Alvina Chu, the epidemiologist from the Florida Department of Health in Orange County. And should we need to do any translation in Spanish, my special assistant, Ms. Ilia Torres, has joined us today. And I don't see any of our other elected officials. Oh, there she is. Commissioner Gomez Cordero always joins us, and she's here with us as well. So with that, I'm going to turn it over to Dr. Raul Pino.
Thank you, Mayor. Thank you, everyone. Hi, everyone. You know, the mayor gave the numbers, so I'm going to go straight to the meat. So our numbers are increasing and are increasing in all directions. The increase is not alarming, but it's trending, which indicates that it will continue if we don't take the necessary steps to curb this increase. Just to give you a quick idea, last week we started observing that every day was higher than the prior day. And that is an indication that things are brewing because it continued to increase. Just to give you an idea, 195, next day 221, the day after 253, and then we have the weekend where we have a little bit of a decrease in testing, but it was an increase in positivity rate, which also indicates that, yes, less people are getting tested, but most of the people who are getting tested are getting positive results. And that's an indication also that is something brewing underneath. Now, yesterday, we had 382 new cases. That's a new high since May 22nd, when we start the positivity rate below 5%. And that's what's bring us to 5.9%. We also have seen, now the new cases are mostly concentrated, the highest percentage is between 15 and 34 years old. And that's the age where we have the most unvaccinated people, besides, younger than 12 that are not eligible for the vaccine. So of those eligible for the vaccine, that age that is eligible, the highest number for us in the new cases are between 15 to 34 years old, very young population. We also have seen an increase in the number of ER visits for COVID-19. We have seen an increase in the number of cases in long-term care facilities from 1 to 8 yesterday. And we also did an interesting analysis. As you may have heard in the news, Dr. Fauci was mentioning that last month, over 99% of the deaths that were reported were among vaccinated people. So we also did an analysis of full death and hospitalizations since we achieved the full immunity. And let me explain, because methodology is important in data collection and results. So we took off all the hospitalizations and death prior to the second week when people acquire full immunization for the first people that we vaccinated. So to clear the data and have a clean cut data. And this is what we found, which is alarming, is that 95% of our hospitalizations were among unvaccinated people. 95% of all death that we have since that day to yesterday were among unvaccinated people. So it means that 95% of hospitalizations and 95% of the death are mostly preventable if those individuals were fully vaccinated. So for anyone who needs or needed a reason to get vaccinated, this is a time to get vaccinated. We also have 2 deaths among the Delta variant cases. Those numbers are at 40 right now, but always remember, those numbers are probably higher, because that's what has been reported to us, that not everything is known. There are a group of asymptomatic cases, and therefore, and one of those deaths was also in a vaccinated individual. So as reported yesterday in the press, there was a study done in Israel that looked at how good the vaccines are against this Delta variant. And although it has been a small decrease in effectiveness in that specific study, doesn't mean that it's global, but in that specific study, the vaccines continue to be effective against this variant, and the vaccines are really, really effective about preventing illness and preventing death. So this is the time to get vaccinated. If we do not take those steps, if the people who are unvaccinated don't adhere to CDC guidelines for unvaccinated individuals, which includes even wearing a mask indoors or crowded spaces for those who are not vaccinated, washing your hands and keeping your distance. We are going to have, as described in the national press, and I think we said it before, we are going to have a pandemic brewing on unvaccinated people, and then we are going to have about 60% of our population protected. We still have about 40% that has not been vaccinated on the data that we have. So guys, it is critical, important to get vaccinated, or this will go up. And we have seen a consequence probably of the holidays, but then on top of that, now we have the 4th of July, and we know what compounding holidays do to us, because we have done it before, is the numbers go a lot higher in a couple of weeks. So please adhere to CDC guidelines, and please get vaccinated. We have the vaccines everywhere, even at the airport. And There are many reasons for people not to get vaccinated, but just remember that in other places, people don't have these. My mother is 85 years old in Cuba. My two sisters, three uncles and aunts in the 80s. And I wish I could fly there and bring the vaccine to them and vaccinate my family. I can't. They don't have access to that. They don't have access to the good vaccines that we have. But we have it, and there are people who are refusing to take it because they are afraid, because they have been misinformed, or because of some political reasons. Please, please, please do it for you, your family, and your friends. The school year is about to start. That's a congregated setting. Remember, children between 6 and 12 are not eligible, so they will go back to school, and they will have to also adhere to some precautionary measures to protect. And these kids, which are mostly asymptomatic in many cases, will be coming back home. For those who are eligible to the vaccine that have not taken it, and probably carrying the infection as well. So with that, please get vaccinated. As the mayor mentioned, Albina Shu is here. Specifically, you have a request about sequencing for the Delta variants, how it's happening, what frequency, but you can ask any questions. And just as an announcement, also, Albina was promoted to Division Chief of Infectious Disease. She's in an acting capacity, but we expect that be confirmed soon. Thank you.
Well, let me just say congratulations to Alvina Chu for the promotion, but also the information that Dr. Pino has shared with you should be somewhat sobering as a reminder that we are still not yet out of the woods as it relates to our response and recovery efforts centered around COVID-19. There's still work to do in our community, and he put it very poignantly as he pointed out the call to action for those who live within our community. Remember that the pinnacle, the threshold that we were looking at for our community where we would have successfully contained the virus was 5%. And we had dipped as low as 3% or so at one point. And here we are at nearly 6%. So that is not what we want to see in our community. And so with the help of our local media and our healthcare experts, hopefully we can increase those numbers and stop the spread of the disease and others who are dying as a result of it. Also, Director Danny Banks from Public Safety Office is here as well. So with that, I'm going to open it up for any questions that any of you may have at this time. Okay, so are we going to use the mic today? Okay, so just so everyone can hear, and our American Sign Language people can be in place as well. Okay.
Thank you. Nadine with News 6. I actually have a question for each of you, if that's okay, while I have the mic. Mayor, how large is our Haitian community here? And I didn't know if you can elaborate more on kind of the effects that they might be feeling on this. And then I have a COVID question for Dr. Pino.
We don't have accurate numbers at this point for the total number of Haitians within our community. I have reached out to the Consul General for Haiti, who is assigned here, and the Vice Consul as well. And we will await any communication from them about what or if anything that we can do as a community here. But suffice it to say that we have a sizable community here from Haiti who have migrated here, who live here within our community. And regardless of any of the politics around what happens there in that country, an individual was assassinated. And so that's why I said earlier, what we can do is offer condolences to his family and to our Haitian residents, and that's what we're going to do. We stand in support of that community here who participate within our local economy and making the community that we live what it is today.
Thank you. Dr. Pino, if we could talk about the increase in numbers, do you think it's just because of the Delta variant? Do you think it's because those who are unvaccinated are living as if they are vaccinated? And what's the message to folks who are vaccinated? Could we be wearing masks again? I don't know. This is a lot of questions.
No, yeah. I think it's a compounding effect of many things. First, the Memorial Day holiday. We knew that 3 weeks about we will see an increase. We didn't know how big the increase. It just came on the eve of the 4th of July, which is a big holiday, and we got into crowds. And then the advice for vaccinated people is to adhere to CDC guidelines. And for those who are vaccinated, the advice has been that even if you are vaccinated and you are concerned and you are going to go in a high density area with a lot of people mingling, it is advised that if you want to have an extra layer of protection, a mask will not hurt to be wear. It's actually advisable. For those, especially if you are vaccinated, you have pre-existing conditions, you have some poor health, you may want to add another layer of protection. And it doesn't say anything negative about the vaccines. We knew that about 5% will be unprotected of those who get vaccinated. That happens with vaccines. Vaccines are not 100%, and these ones are very good at 95, 96. So with that, people should use caution and precautions when getting in large crowds.
Mi pregunta es para Dr. Pino, por favor. Alibet Suárez con Telemundo 31. Justamente quisiera preguntarle sobre esta nueva tendencia de casos, si nos pudiera explicar hospitalizaciones además, y explicó sobre estas medidas que se van a tomar en caso de que continúe siendo de esta manera, si nos pudiera explicar.
Bueno, para nuestra gente en español, hemos visto un incremento del número de casos diarios. Cada día ha sido mayor que el día anterior. Las hospitalizaciones se mantienen bajas, pero se ha incrementado el número de visitas a los centros de emergencia. Y eso siempre precede un incremento de las hospitalizaciones. También hemos visto un incremento pequeño en el número de casos en ancianos que viven en assisted living facilities, en asilos de ancianos. Y la idea ha sido que no creo que debamos de estar alarmados, pero creemos de que debemos de ser precavidos y tomar las precauciones, especialmente para esos que no están vacunados. Le pedimos, por favor, que también pongan énfasis en las personas que tienen de 12 a 34 años, son las personas en las que hemos visto el mayor número de casos, especialmente los niños que califican para la vacuna deberían vacunarse antes de regresar a la escuela.
Mayor, I have a couple of questions for you and Dr. Pino.
Okay.
The Haitian situation. There's fear that the country is going to become or is unstable. Just your thoughts on that.
Well, because we have so many of our residents who live here who are from Haiti, we have to feel for that country as well. I think the United States is in a position where it certainly can be a friend to Haiti as they go through this. Whenever there's a leader of any country that is assassinated, I believe that sends shockwaves throughout that particular country, and there's no doubt in my mind that has happened there within Haiti. And so these next few days, I believe, will set the tone for how that country responds and how our country responds as well.
On the COVID situation, you mentioned that the numbers are going up and that it's sobering. What is your worst fear?
Well, my worst fear is that more people will die and more people will contract the disease. That is not what we want to have in this community, especially when it could be avoidable or preventable. And we have the solution, and the solution clearly is getting vaccinated. While Dr. Pino elaborated on the fact that there are a very few people who have been vaccinated who have secondarily contracted the disease, it's a very few people. So the odds are clearly in your favor to withstand potentially being infected with the virus by simply getting vaccinated. And so sometimes it's mind-boggling to understand why individuals are hesitant to do so. So only through the collaborative of our community and the culture that we have here will we drive those numbers up. And so that's what we work to do. That's why we have these press briefings. We are not giving up on our response and recovery efforts. We all have endeavored to re-engage socially and to ignite our local economy. Well, by the same token, we have continued to offer cautionary tales to our residents as we have opened things back up. We clearly do not want to go in the opposite direction. We are still offering free vaccination opportunities here within this community, and we're trying to leverage the dollars that we have received to be able to do that. We're trying to make it as convenient as we possibly can for people to get vaccinated by doing the mobile vaccination trail and moving it throughout our community, as well as entering into various partnerships with community-based organizations. So if there's a community-based organization that wants to partner with us in this process, we invite all of them to be able to do so. So we don't want to leave anyone behind in this process.
Thank you, Mayor. I appreciate it. Dr. Pino, same question for you. What's your worst fear?
A variant that is so aggressive that the vaccine will not be effective. So that's the worst fear, the worst scenario for anyone. So that people understand, unvaccinated people are a factory for variants. Because natural selection, it's not that the virus is smart, it's that it mutates in the process. The more people that have the ability to host a virus because they are not vaccinated, the more likely that the virus will continue to mutate. And those mutations are going to survive the ones that are most infectious, because those are the ones that are going to spread quicker than the other mutations. So with that, what we want to do is to reduce the pool in which the virus can thrive in our community. That's about 40% of our community. And that's a significant number. I mean, we have 1.4 million. So we are talking about thousands of people. And also for the people, to alert the people that are vaccinated or are missing the second dose, your immunization is not completed. And those numbers are in the thousands as well. So it is critical that we engage in this vaccination effort to reduce the ability of the virus to mutate within our community and to spread among unvaccinated people. And remember, there are a group of people that cannot be vaccinated for health reasons or other reasons. And by increasing our numbers, we can also protect those who can't be vaccinated because they are going through chemotherapy, because they have immune disease disorders, or because severe allergies. And there are many examples out there in our community. Those are our worst fears.
Steve Hudak from the Orlando Sentinel. This is for Dr. Pino, if that's okay. Dr. Pino, would you be kind enough to go through some raw numbers on when we talk about 95% of the hospitalizations are unvaccinated people and 95% of the deaths? How many deaths are we talking about? What kind of...
Let me double check the data. I believe it's 177, but I will give you that number right away. So, 177 deaths out of 185. Our count started on February 6th to June 22nd. In that period, we have 185 deaths, 177, 95.7 were among unvaccinated people that we know. For hospitalizations in the same period, we have 530 and 506, 95.5% were unvaccinated people that we know based on the records that we have. Those are the raw numbers.
Do you expect those numbers to continue to rise?
All depends how we behave. Our county continue to be in a strong position, but the CDC has moved us from low transmission to sustained transmission based on the new numbers. And that's an indication also that things are brewing in the background. And again, our concern is with unvaccinated individuals. It is preventable. Those hospitalizations are preventable. Those deaths, many of them were also preventable from getting vaccinated. And recently I saw the story, I think it was Lawrence Seabrook, who interviewed an individual who was not vaccinated, and he and his wife both contracted the disease, and sadly their wife died. And that's what we are trying to prevent, is preventing someone who is in full capacity of their life to die so early from a disease that is right now preventable. It wasn't preventable before December through clinical intervention. It was through physical barriers. But now we have a clinical intervention. We have a medication. We have a vaccine, a product that can prevent this disease.
This is for Dr. Pino, en español para Univisión Orlando. Doctor, usted hablaba de varias razones por las cuales mucha gente no quiere tomar la vacuna hasta ahora. La comunidad hispana, hay un grupo grande de personas que todavía tienen, digamos que, miedo de dar alguna información por su estatus legal. ¿Cuál es la política del condado Orange para vacunar a estas personas y si es un miedo infundado? Y por otra parte me gustaría que me dé los datos de la nueva variante en el condado que dio anteriormente.
And before I do that, for our English speakers, the answers that I gave before in Spanish were the same that I gave before in English, so nothing new. But I will do it right now in both languages. The question was if I could talk about the number of variants and also about undocumented individuals and what the policies of the department are with regard to those fears to be vaccinated for those who are undocumented. In English first, there is no reason to be afraid of coming to the health department if you are undocumented. You are protected by HIPAA. We just can't share your information. We will be in legal troubles if we share your information with anyone. Even that we are a government agency, there is protections in place. Those data sets are not connected to immigration services, to police, to anyone. Our data sets are totally blocked from anyone accessing those data. We do not share that information with anyone. Para la gente en español, con los que tienen temores porque están en nuestro país de manera indocumentada, los temores son infundados. Yo los entiendo, yo entiendo el temor, pero déjenme explicarle algo, y yo les doy mi palabra en esto. Nosotros no compartimos información de ninguna persona con ninguna agencia del gobierno. No podemos legalmente, las protecciones de HIPAA también aplican para las personas que están en el país de manera indocumentada. Nosotros no podemos, esas bases de datos no están conectadas a ninguna computadora, no tiene acceso la policía, no tiene acceso nadie. Incluso legalmente, para que ustedes sepan, si alguna agencia del gobierno pide acceso a nuestra información por problemas legales, criminalidad u otros aspectos, ellos tienen que ir a la corte a demostrar de que esa información es absolutamente necesaria. Incluso cuando van a la corte, esa información se limpia todas las identificaciones que puedan tener. Número de seguro social, si la persona está aquí legal, número de teléfono, el nombre, todas esas cosas se eliminan. Con respecto a los números de las variantes, tenemos 40 de la variante Delta. Parte de la preocupación es que hemos tenido 2 muertes en esa variante y una de esas muertes fue en una persona que ya se había vacunado. Y entonces hablamos también de la efectividad. La vacuna continúa siendo efectiva en el más del 90% efectiva, pero siempre hay un número de personas que pueden contraer la enfermedad. Lo importante es que para esos que están vacunados y adquieren la enfermedad, en esos casos incluso todavía previene que la persona se ponga realmente enferma y previene la muerte. Gracias.
Question for Dr. Pino. Within the group that remains unvaccinated, is there a certain demographic that is still being difficult to reach, and perhaps a question for you, Mayor Demings, as well, and within that 15 to 24 age group, what are the ways that you're trying to bring them in and give them the good information to convince them to become part of those who are vaccinated?
I think Albina is in better position than I to answer that question. With regard, she has been looking to the data.
For the unvaccinated population, so it remains to be the persons who are in that 15 to 24 and the 25 to 34 age group who remain unvaccinated. And part of our outreaches have been to go to where the young people are. So we have a partnership with UCF as an academic center. They also conduct genomic surveillance on all student populations. And so they also have an effort to try to get students to become vaccinated. We're also looking into partnerships with certain outreach groups that we have established with other programs within our health departments. Those programs that reach out to younger populations, sometimes at bars. I think we've had these previous conversations during the Hep A outbreak about outreaches that target younger people where they are, such as bars and nightclubs and other gatherings.
And a follow-up, if I may, with the prevalence of the variants, and as you mentioned, they might mutate and you're concerned about their effectiveness on the vaccines available. Is there an idea of how soon we might need a booster shot from some of those vaccines to potentially help further prevent the spread of them?
So there's studies ongoing about the effectiveness of the vaccines with all the variants that occur. So as we've discussed before, the variations occur every time. Essentially, there's that possibility for the virus to mutate every time there's a new infection. To give you a sense, and this is reflected in national data, is as of July 4th, the Delta variant was about 30% of all cases that were identified. All variant cases are identified in Orange County residents. In the 2 weeks prior to that, it was less than 15, and then 2 weeks prior to that, it was 0. And so CDC projections nationally is that within the next 2 to 4 weeks that the Delta variant will overtake the B117 alpha variant as the predominant variant strain. The part of the genomic surveillance that we conduct includes looking for variants of concern or of interest where we don't exactly know what its characteristics are. So the genomic surveillance programs that we have nationally and locally look to see what they're focused on persons who have infections that result in severe hospitalizations and deaths, and that's how we identify what might be needed in the future.
One question that was texted in from Melissa Thomas with Florida National News for Mayor Demings. The question reads, given your emergency response expertise, what, if any, adaptations or changes have you or will you make in getting folks vaccinated in the midst of a tropical storm or hurricane, especially since we're no longer on a lockdown like we were last hurricane season?
Well, we continue to look at our experience in the here and now, and we're fortunate that at least for the time being, the weather phenomena has not prohibited us from being able to continue to offer the vaccination or the vaccine within our community. So we will continue to do that, but we will be in consultation with Dr. Pino and our hospitals and other healthcare experts here about next steps, what we may need to do to make any adjustments, if you will. We continue to do outreach through partnering with community-based organizations. That includes those from the faith community. It includes fraternal and sorority types of organizations and some other community-based organizations where we are going out into the community to make certain that it remains available and accessible to anyone who desires to get the vaccine. I am reminded today, after hearing from our experts from the Department of Health, these are individuals who are well qualified. Their staffs are looking at all of the available data worldwide and certainly here within the U.S. about this particular virus. And what they're telling us is that, again, the solution to preventing the virus from being spread, an individual from contracting it, is to simply get vaccinated. So I would urge everyone, pay attention to your physicians. The vaccine is widely available now in various places. Our retail pharmacies and others, our personal physicians' offices have access to the vaccine. So we will take the information that we have, recalibrate to understand if there are additional things that we can do to make it more available and accessible within our community. And that's something that has been ongoing throughout the process of responding to this virus. And so this is why this is the 140th press briefing that we have done since we started this last year. So sharing accurate information in a timely manner is very important to that process. And so this kind of renews my belief that we have to kind of double down at this point when we have seen this significant increase in a relatively short period of time with this new strain of variant that is taking hold in our community. We have to make an adjustment. We have to make that adjustment in multiple languages within our community, and we are dependent upon our local media to help us in that process. And so we have the right partnerships. Our school district has been on board with this process as well. As we move forward during the remainder of hurricane season, we have done our outreach to the assisted living facilities and other vulnerable communities to identify individuals within those communities who will need access if there is a storm that affects our community. We are well prepared. So we just had what I'm going to call a dress rehearsal for our response to Elsa, but we have a long way to go to get through November. So it is clearly the height of our hurricane season is next month, August, September, during that period of time. And so here we are early during the season, and we have already had our first hurricane named. So again, let me just say, if there are no other questions, thank you to all of you for coming today. We do have various staff members who are available for one-on-ones to include Division Chief Avery, our emergency manager, Director Danny Banks, our public safety director, certainly Dr. Pino, Ms. Alvina Chu is here, and Ms. Sherry Babinski from the Orange County Public Schools is here as well. And lastly, let me just say thank you to our American Sign Language interpreters for doing the job to ensure that we are reaching those who are hearing impaired within our community. Thank you so much.